I wear it for the reason that I believe it is effective. It's not 100% effective. I mean, it's sort of respect for another person and have that other person respect you. You wear a mask, they wear a mask, you protect each other. I mean, I do it when I'm in the public for the reasons that, A, I want to protect myself and protect others, and also because I want to make it be a symbol for people to see that that's the kind of thing you should be doing.
Dr. Fauci saying, wear your mask outside. Joining us now, President and CEO of the Robert Wood Johnson Foundation, Dr. Richard Besser. He's a former acting director of the CDC and was appointed by New Jersey Governor Phil Murphy to a board that is coordinating the state's reopening. The foundation has just released its health equity principles for state and local leaders in reopening and recovering from COVID-19. Also with us, assistant professor at Harvard School of Public Health, Joseph Allen, who is looking at airborne transmission of the virus. Gentlemen, good morning to you both. Professor, I will start with you. Your piece about airborne transmission. We know about the droplets. It's why we wear the mask. It's why we maintain that 6 feet of social distancing. But what do you mean by airborne transmission? Because this has new implications for how it could be spread and perhaps how far we actually need to be away from each other.
Yeah, I'll lay it out like this. CDC and WHO have been really reluctant to acknowledge that airborne transmission is happening, despite evidence going back to February that this is the case. We know large droplet is important, and that's why we have physical distancing, as you say. Fomite may also be important. CDC has been saying this is why you clean and disinfect surfaces and wash hands, but they've been ignoring airborne transmission. Let me give you an example to highlight how we know this is happening. I've done forensic investigations for over 10 years, forensic investigations of sick buildings. Take that choir practice that we all know about. 60 people, over 50 got sick, 2 died. If you go through a process of elimination through these modes of transmission, it becomes clear airborne happened there for sure. Was it fomite or contaminated surfaces? Unlikely. Each person handled their own share and they did hand washing. Was it large droplet? Maybe that contributed, but if I was a singer, I would infect the people right around me. You can't get 50 people infected unless it's airborne is playing a role there. And here's what tipped me off and caught my eye from doing these forensic investigations. The choir practice happened at 6:30 to 9 p.m. at night. Do you know what happens in buildings at that hour? They turn off the ventilation system. So, there's clear telltale signs here, the cruise ship, Biogen, and many others, that airborne is happening. And I don't understand the reluctance to acknowledge this. We need to acknowledge it if we're going to put in the appropriate controls to get this pandemic under control before a vaccine.
Okay, so Professor, on behalf of all my viewers right now, I'm going to ask you the question, what do I do with that information? I thought I had to stay 6 feet apart. I thought I just had to wear the mask, and it was beginning to get safer to go outside and to have a bit of a summer. What do I do with this information that it could be lingering in the air around us?
Yeah, so I totally understand that. And it's actually, this isn't rocket science, how to put in these controls. The first step is to recognize it's happening. And then what we have to do is stay smart. So here's an acronym for you, really easy, SMART. Stay home if you can, especially if sick. M, mask when out. A, avoid large groups and gatherings. R, refresh that indoor air. And T, 10 feet is better than 6. So we know for droplets is 6 feet, but the further you are away, even better. So it's actually pretty simple. Stay smart. We can put in these controls. First step is to recognize this. And then I think we all know what we can do and put it on ourselves and building owners and schools and everyone else to put in the appropriate controls.
Dr. Besser, Mike Barnicle's here. He's got a question for you. Mike?
Yeah, Dr. Willie just raised a question that many people ask, and one of many questions that seemingly are unanswerable about the virus. My question to you is, we are on the verge of a political, cultural, and economic question that has to be answered soon, and it is about sending our children back to school, especially younger children, K through 6 or whatever. How do we do this? How do we sit here knowing that our children are going off to school in late August or September, and that they'll be safe? How do we do this?
Yeah, Mike, this is a really challenging issue. We need to recognize that children do need to get back to school. that there are major costs in terms of their development, their education, in not being in school. For many children, there's issues in terms of nutrition, just getting enough to eat by not being in school. But we have to do it in a smart way, and it has to be based on the best available public health science. You know, there is information from other countries as children have been going back to school to understand what can be done. But it takes a national commitment. Now with 100,000 people who've died, such a striking, overwhelming number, we have to recommit to doing the public health work. The steps of wearing masks, social distancing, washing hands, keeping people home when they're sick. You can imagine with schools, just like with businesses, doing some kind of screening. So a health questionnaire and a temperature check when kids come to school. The biggest risk for school isn't to the kids, because thankfully, most children who get this will do well. I'm a pediatrician, and it helps me sleep at night knowing that. But teachers, staff, all of the people who work at schools, many lower income workers who are at schools, we need to make sure that they're protected, that they have the right protective equipment, that if they're not able to work at school, they're still getting paid. So many people in America right now are having to make the choice between going to work in order to earn income to put food on the table, or staying home and doing things to protect themselves and their community. And as the economy revs up, we have to make sure that that isn't a bind that so many people are being put in.
Dr. Besser, we heard a bit of that interview with Dr. Fauci yesterday. Also in that interview, he began to say he's cautiously optimistic, perhaps, that the fall may not be as bad as some had predicted it been. I guess what he said actually was that if we continue to behave responsibly, it's not inevitable that we have a bad fall, as so many people have predicted. What can we do as a country as people begin to step back out of their homes after 2 months effectively in lockdown and start to enjoy the summer and go to beaches and step out and go to restaurants? How should people be thinking about their own behavior this summer to perhaps stem what many have predicted could be a bad fall again?
Yeah, you know, one of the reasons, Willie, it's so hard to predict what the fall is going to look like is that so much is dependent on what we decide to do. We can't control whether the virus decides it's coming back strong as weather gets cold, but we can decide, are we going to do those things for ourselves to ensure that we are reducing our risk and our risks to others? Are we wearing masks to protect those around us? And are we going to take the steps to ensure that everyone in America has that protection? You know, we've talked about it before, Black Americans, Latino Americans, Native Americans dying at very high rates. Why do we take that as acceptable? Why aren't we ensuring that everyone has access to protective equipment, that people have money to stay home if they're sick and to take care of their family, so they're not being forced into these situations? It's a decision we have to make. We put out these health equity principles to provide some guidance to states so that they're working with the most affected communities. They're addressing these needs. They're addressing these barriers. You know, we talk about testing and tracking, but the critical piece we don't spend enough time talking about is the quarantine and isolation. How do we ensure that everyone in America who is infected or has had contact with someone who's infected has a safe place to be so that they don't infect others? You know, that's been the key in so many countries, is that when they identify someone who could spread it, they take them out of circulation in a way that's supportive, that's culturally appropriate, so that they're safe. We're not doing that. We're saying, hey, you're infected, go on home and don't infect other people. And that's not something that so many people have the opportunity to do.
And it's a difficult thing to do in the scale of a country our size, but it's a worthy goal. Dr. Richard Besser, thank you. Joseph Allen, thank you as well. He is assistant professor at Harvard School of Public Health, and his new piece is in the Washington Post. Gentlemen, thanks as always. In about a half hour, we are expecting a new record high in the number of people seeking jobless benefits in this country, possibly about 40 million. We will bring you that new report from the Labor Department as soon as it crosses. Morning Joe's back in 1 minute.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.